question I ask the other side from a different perspective. I've seen polling on this issue. There's likely to be a measure on the ballot in November. If, in fact, we go back to Roe, I think that adds pressure to enact that. If, in fact, however, you win and the court decides 15 weeks is fine, which is more than 90% of abortions occur within 15 weeks, doesn't that reduce the need for voters to go ahead and enshrine constitutional protection into the Constitution?
I don't think that it necessarily does, Howard, because as you know, the ballot initiative would go beyond 15 weeks, and so I'm not here necessarily to talk about the ballot initiative, but it's going to be important for the people of Arizona ultimately to have the final say of this issue, and I'm hopeful that that initiative will pass. It will, it will end this debate, but between now and then, what this court decides will be incredibly important. Right now, though, as you know, I am not a huge fan of the 15-week ban. Let's remember the 15-week ban, in addition to the territorial ban, has no exception for rape or incest. But at least it's some certainty for abortion providers up to 15 weeks. So I think we do still need that initiative, and that'll be important. But this case was fundamentally about statutory interpretation, and it was about trying to prevent the reimposition of a territorial abortion ban on the women of Arizona.
If the
Jeremy.
Supreme Court does return to the territorial law, will you enforce that?
Well, I've been very clear that we are not going to prioritize prosecuting doctors for abortion in the state of Arizona. So, no, we will not be doing abortion prosecutions in Arizona while I'm Attorney General, ever. We have much more important issues to decide and work on in this state. I'm busy prosecuting the drug cartels who are killing our kids with fentanyl. I'm busy protecting our consumers. I am busy protecting our environment and fighting for our water supplies. I do not think it is a good use of the resources of the Attorney General's office to prosecute doctors.
Obviously, the language in the 15-week ban about not repealing 3603 could have been clearer, as we heard today. But how can it be argued that the legislature really intended for anything but that law to be enforced, if possible, to enforce it? I mean, if it wanted to draw a kind of more technical distinction between like doctors and non-doctors and other people performing abortions, wouldn't they have laid that out more clearly?
Well, I actually think several of the justices made really good points, and they were points that were made by our team and by Planned Parenthood, that if the legislature had wanted the territorial ban to go into place, they would have passed a trigger provision in the law, and they did not do that. And if the legislature wanted us to go back to 1864, they could have made that clear. What they did was they passed a 15-week ban and said that up to 15 weeks, abortions are allowable, and that for the life of the mother, abortions are allowable after that. But so I think it's very obvious that the legislature didn't pass a total ban. They were intending to mimic the Mississippi provision, and they could have gone all the way to 1864 if they had wanted to at the time. And I think, as our attorneys said during the oral arguments, even Governor Ducey believed that the 15-week ban would be in place. And I think that's very persuasive, circumstantial evidence that that's what was intended.
But if they had intended their intent was as your side laid out in court, wouldn't they have said that explicitly in the law as well?
No, I think they passed the law that they meant to be in place. I mean, it's very simple, and they passed a 15-week law. I mean, there was, as you guys know, having been around in the waning hours of the legislative session, there was a push to try by Jay Kaufman and others to try to get a total ban on abortion into place, and Ben Toma pushed back against that, and they didn't do it. They passed a 15-week ban, and so I think that's what holds now, and I think that's the fundamental argument that we made. And then I don't want it to be lost as well what this case really was about, which is that when you have a more general and an older law, and then you have a newer, more specific law, basic and well accepted statutory interpretation says that the newer, more specific law holds.
So are you concerned about enforcement at the county level with county attorneys if the ruling does go with the territorial ban?
Laura, do you want to handle that?
Well, that's absolutely the concern, and it goes back to equal access. You're going to have 15 county attorneys interpreting the law and using the resources that they have, which is always limited, and discretion will take place. I continue to think that the uncertainty and the confusion is not going to be with enforcement. It's right now with the law, and the law needs to be clarified. One thing I'll also say as well that I think we all heard in there were a lot of brilliant legal minds who have studied the issue. But to my knowledge, no one behind the bench or in front of the bench has a medical degree. And that's the problem with all of this. This is a public health issue, and it's a conversation between a provider and a patient that sometimes occur while the patient's life is absolutely in danger right in the emergency room. And so I think the people of Arizona are going to have the final word ultimately and decide that this shouldn't be determined by the government, that the government shouldn't intervene in between a patient and doctor, that this is a health issue and the government should step out of it.
I have a quick question,
Go ahead,
I'm sorry,
Yeah.
Attorney General, of appearances. So we've heard multiple times from the podium today and from this side of the argument that this is an issue that is between a woman and her doctor. And this case today is entirely argued by men. Can someone please comment on that?
Well, well, first of all, I'm the Attorney General, and I am a woman. And I certainly participated and directed the preparation of this case. It was also, we had, as I mentioned from the beginning, we had several female attorneys working closely on it. I'll be honest with you, we had this discussion. When we were preparing the case, but ultimately we assigned the attorneys who had been working on it the longest, and Josh Bender is the best lawyer in Arizona. So I'm the quarterback I'm the coach of the team. I sent in the best oral arguer in the state of Arizona, a guy with tremendous experience. But we had women working on this case, and I'm the female Attorney General of Arizona, only the second female Attorney General ever to serve.
Can I add a word? I'm sorry.
Oh, and Laura's
I'm sorry.
a woman
I'd really like to add a word to that because I appreciate the question. I do, and I am the Pima County Attorney. And what I'll add to this, and what we have seen time and again, when we are talking about the life of a woman being at risk in an emergency situation, all too often, it's the husband pacing in the room, it's the partner pacing in the room. The ripple effects affect families. And the stories that we have heard nationwide about couples being sent back out into the parking lot to wait until your life is in danger enough, then come back in, and then we can provide you life-saving care. This affects whole families, including older siblings who are sometimes waiting for mom and dad to come home with the baby. These are the life and death situations at play and the real world consequences when we inject the government and the legislature and the courts and prosecutors and law enforcement into a healthcare decision.
Let me follow up to the question that he asked about county attorneys.
Yeah, I was just
Laura
going to
answered,
come back to
which
that.
is the issue of the governor contends she issued an executive order saying she's turning it all over to you. These county attorneys are elected. Do you honestly believe that you can stop 15 county attorneys, or maybe 14, taking out Laura, from enforcing the law if this case, the court will decide 133603 prevails?
So, yeah, I mean, I believe that the governor's executive order should be enforced. I believe that she placed the decision-making authority over abortion prosecution in our office. And if any county attorney attempts to prosecute a doctor or a medical provider for abortion, I will exercise my supervisory authority over that county attorney, and I will seek to stop it. I would have done that without the executive order. I mean, let me be clear, I have supervisory authority. I made it clear on the campaign trail that I was going to exercise supervisory authority over any county attorney who attempted to prosecute women or doctors. And I do think this is an important question. We have one county attorney, unfortunately from my home county, Yavapai County, who was an intervener in this case, who, you know, you have to wonder what his intentions are. What does Dennis McGrain intend to do in Yavapai County? If I'm a medical provider at the Yavapai Regional Medical Center or the Cottonwood Hospital, I got to be worried about that. And so that's one of the reasons this case was so incredibly important. And so, yeah, I do intend to enforce that executive order. We've had some good conversations with county attorneys, and I understand where they're coming from on this issue and whether it sets precedent for other matters. We've had some really good conversations, but I've been really clear that I don't want to see them moving forward with prosecutions, and if they try, I will stand against them.
The law the governor cited in his executive order has never been litigated, and it's only been used once. How confident are you that will stand up in a court challenge, which will almost certainly no? Yeah,
well, we'll see. I mean, well, let me put it this way. I hope we won't see, because I hope what the county attorneys will do, and I believe that there aren't very many county attorneys chomping at the bit to prosecute doctors for medical care. But we do have one county attorney, Dennis McGrain, that apparently believes in the territorial abortion ban. And we have the Maricopa County Attorney, Rachel Mitchell, who has been clear as mud about exactly where she stands on all this. Yes, Barbara.
Heard from the mostly conservative judges, just how common are you that the outcome has been elevated since you heard it today?
Yeah, I thought the questions from the bench were excellent, and they were clearly fully engaged. They were well briefed. They had read all the pleadings, so you never want to predict what a court is going to do. I'm sure Josh would get really upset with me if I tried to do that. But I thought their questions were excellent. I feel very good about the direction that their questions, at least a majority of the justices were going, and we'll have to see. I can't fathom a situation in which our Supreme Court wants to take us back to 1864, but we will see, and we'll deal with that when it's over with.
We've got time for one more question. One more. If anyone has one.
We're waiting for the re-election announcement.
What, Howard? No, okay. All right. Thank you, everybody. We appreciate you.
Thank you. Thank you.
Get it on the ballot. Vote
Barb, I think Planned Parenthood's doing something.
Who's
Oh, yeah. Sorry about that.
kind of sitting on the fence whether or not to hang on there, so thank you. Well, okay.
Jennifer, come on up.
Whose is this? Who's wireless? Oh, yours? Yes. I'm taking.
Oh, you're
this
taking this?
podium.
Okay.
Yeah.
Okay.
Sorry.
Nope, you're good. Sorry.
Whose is this? I'm taking this podium, so.
Well, you get the wireless mic then.
Yeah, I don't want it.
I'll take the mic stand, guys. I gotta go. So sorry.
Here, I think I know.
Yeah.
We have another mic stand
Yeah.
for PPAZ statements coming. If anybody wants to stay for that.
Guys, I'm gonna take the mic stand. I gotta run. Sorry. Yeah. Sorry, you guys.
Okay.
That's exactly what I'm going to say. Although I think you got it.
Sorry, guys. I gotta run. All right.
Oh yeah. Absolutely. Go ahead.
Yeah.
Secure.
All right.
Grab my.
You have them. We're gonna try to grab another one.
Okay.
Happy to just say.
Hey, quick and dirty, please.
Yeah, that's the plan.
I am gonna use all of that. Excuse me. It is still a little.
Come on, Howie. Hey, Howie. Molly.
You want me to grab mine?
Nice to see you in person.
Okay, watch that. Maybe I want a concussion. You know. Sure. Go for it. Excuse me.
Hey, in my bag is a sandbag in the green cart.
Yes, I do. Thank you. Thanks so much.
Yes, yeah, yeah. But, you know,
They're gonna. So is the attorney on a clock like upstairs? Are you on a clock like upstairs? You got the contact. Okay. Well, we're all
works for you guys.
deadlines here. So yes. Well, you have to go forward. I'm not.
Like the candy.
I was like, I'm coming all the way from Chandler.
You might want to pop your bottom thing off first and then pop everything.
Oh, yeah, I parked right there. Right there. We were texting each other, but you know.
All right, we looking good? Yep. All right, folks. Morning, everyone. Thanks for your patience. My name is Molly Goddard. I'm of Planned Parenthood, Arizona. Today, you will hear from our Chief Medical Officer, Dr. Jill Gibson, followed by our legal counsel, Andy Ganoa, and then we will take questions after those statements. And without further ado, please, Dr. Gibson.
Thank you, Molly. Good morning, and thank you to everyone for being here today and covering these important events. My name is Dr. Jill Gibson, and I am the Chief Medical Officer at Planned Parenthood, Arizona. As an obstetrician-gynecologist who has treated hundreds of patients seeking abortion care for the past 14 years, and a mother of 3 little girls, I know firsthand that comprehensive reproductive care and access to abortion for all people is absolutely essential. Criminalizing abortion does not reduce the need and demand for this basic healthcare procedure. If the court allows this archaic, near total abortion ban to go into effect, there would be an immediate and devastating real-life effect. Our patients will be forced to seek abortion in other states, away from their support in their communities. They will struggle to find someone to watch their children so that they can travel, to get time off of work from the 2 to 3 jobs they hold down just to make ends meet. But the truth is that the vast majority won't have the resources to make it out of state and will be forced to carry pregnancies and raise children that they recognize they cannot emotionally, physically, or financially support. Let me tell you about a patient that I cared for recently. This patient is a mother. She works. She is doing what she can for her family. But she has a partner who physically abuses her. She said to me very clearly that, quote, "I know that if I don't have an abortion, the physical beatings will only get worse for me and this child. But at the same time, my partner would never allow me to have an abortion." So she plans for an abortion by pills, so it might appear as though she miscarried, and reduce the chance that her partner finds out the truth and abuses her more. How would this patient, whose actions and activities are heavily monitored by a violently abusive partner, get out of state for her abortion? An abortion ban effectively tethers her and so many others in similar positions to toxic and harmful partners. Abortion bans not only negatively impact individual lives, they impact families and generations and perpetuate other systems of oppression. Let's consider for a moment another systemic problem that will be amplified if an abortion ban takes effect. Arizona's maternal mortality rate has tragically quadrupled over the past 2 decades. Quadrupled. Data from the year and a half since the overturn of Roe v. Wade show that pregnant people in states with abortion bans are nearly 3 times as likely to die in pregnancy, childbirth, or soon after delivery. Are we prepared in Arizona to intentionally cause our maternal mortality rate to become even more unacceptable? We know that abortion bans have the greatest impact on Black, Indigenous, Latinx, LGBTQ+ folks, and undocumented people, all those groups who already face systemic discrimination in our healthcare system. A near total ban would be devastating for these communities, furthering legacies of harm. Arizonans deserve better. The court has the opportunity to refuse this bleak future, and I am here today with the hope that the court will side with the majority of Arizonans in rejecting this extreme, unpopular, and egregious threat to reproductive health care. I hold on to the hope that I and my fellow health center staff will be able to continue to provide the life-saving and life-changing care that our patients so desperately need. And while I know that you all have many questions today, I do want to make one last point very clear. Planned Parenthood Arizona's doors remain open, and we are committed to providing sexual and reproductive health care for all Arizonans, including abortion. We know that the work is far from done, and Planned Parenthood will not stop fighting for our patients at the courthouse and beyond. We won't stop, we won't quit, we will restore a state that respects bodily autonomy. Thank you. And I'll turn it over to our legal counsel.
Can you please speak up? Yeah, there's a lot of
Yeah. Thanks, Howie. I appreciate that. What's up?
Thank you.
Well, good morning, everybody. I'm a lawyer, so I do most of my talking in court, whether it's standing up there as I was earlier or in writing. But what I will say that I feel confident after today's argument that the court will put precedent over politics and rule in favor of Planned Parenthood and to ensure that Arizonans have access to abortion up to 15 weeks LMP. In our view, this case has been clear and straightforward from the get-go. There have been some hiccups along the way, including leading Planned Parenthood to have to close its doors to patients for a while. That was a tragedy. It can't happen again. It shouldn't happen again. And I have every confidence that the court will see through the interveners' arguments that are based not truly in law, but on their fundamental opposition to bodily autonomy for pregnant people, and uphold the 15-week law passed by the legislature in 2022. The real heroes in all of this are Dr. Gibson and the clinical staff at Planned Parenthood and the other providers in Arizona. They're the ones you should want to talk to about their experiences under these laws and these restrictions. And we should all be thanking them for providing such an important healthcare service to pregnant Arizonans amidst a very volatile climate, amidst protests, and that is why this case is so important. Doctors need to be able to provide health care to their patients. The state shouldn't get in the way of that, and we sincerely hope that the Supreme Court agrees with that. So with that, Dr. Gibson and I are happy to take questions.
Let me ask you the same question I've asked everybody else. We have an election coming up, presumably in November. I've seen polling in terms of where people stand from 0 weeks to 22 or out to 39. Most abortions, as you know, in this state are performed before 15 weeks. If you win, doesn't that reduce the pressure on folks to say, we don't want anything that theoretically allows post-viability abortions in certain circumstances?
So in a post-obs world, we now have a very clear understanding that we need to do absolutely everything we can to ensure that we have protection for all aspects of sexual and reproductive health care, and we need that protection at the highest level. And that means that we will not stand for any bans. We know that bans simply make abortion out of reach for those who need it the most, and Planned Parenthood will continue to fight and advocate for those decisions to be made between a patient and their healthcare provider, and not the court of law.
Gibson, we heard a lot from the Alliance Defending Freedom attorney on the distinction between an abortion needed to save a life of the mother and one that would be life-saving but not necessarily an emergency that they believe would be permitted after 15 weeks. Do you view, in your view, what's something that would meet those criteria of an emergency but not immediately necessary?
That was a very confusing argument for me, and I'm not sure that has any standing for a physician. What I can tell you is that being a physician with those kind of stipulations puts us in a completely untenable position. A physician should not have to consult their attorney in order to understand if they can provide basic essential health care. And stipulations such as that the ADF attorney was arguing simply put doctors in really difficult positions and are going completely contrary to the oath that we have taken to provide the care that we know how to provide to our patients.
What, if any, contingency plans does Planned Parenthood have if the court decides to go with a territorial ban?
So Planned Parenthood offers a whole host of sexual and reproductive health care services. We are extremely proud of our abortion service line, but we actually have the majority of our services are preventative health care services. So patients come to us for their gender-affirming hormone therapy, for their STI testing and treatment, for their birth control. And we understand that if there is a complete abortion ban in this state, all of those services have a newfound importance, and we will be here to support our communities in that regard. We've also established a patient navigator program. Keisha Talbert is our patient navigator and registered nurse. She currently, even in the context of a 15-week ban, works every day helping to get patients who are in our state who need abortion care after 50 weeks out of the state. And so her work would become even more important with a total abortion ban so that we can help Arizonans get the care that they need. That would still be a commitment and a very important part of our work if this unfortunate ban were to take place. Yeah, I think you're speaking to a really important point, and this is what we found since basically the leak of the draft opinion of the Supreme Court of the United States, is that part of the most difficult part of what happened was that patients were really caught in the crosshairs of this argument that should really be left up to them and their providers. And so Planned Parenthood has worked really hard to have that education campaign. to be on social media disputing all of the misconceptions and all of the misinformation that is being spread very, very rapidly. But I have to say that a lot of our patients are already disenfranchised from the medical community. They already have reservations about coming in and getting care because there are just legacies of historic racism that take place in our medical system. And so we're already fighting that unfortunate reality, and now to have this additional confusion for patients and have to spend time talking to patients about what is legal rather than talking to them about their very real healthcare needs is a waste of time. So what I would say that I'm the Chief Medical Officer at Planned Parenthood Arizona, and I'm here today flanked by the rest of our representatives, April Donovan, our CEO, Chris Love, our Senior Advisor, Sheena Chang, our Board Chair. And you know what I think is really the most important part of this whole discussion is that we are here today because this is the team that feels the most passionately and speaks the most eloquently, and this is the team that we assembled because we know what's at stake and we know the importance of making sure that the Supreme Court hears our arguments and understands the realities of what this abortion ban could enact.
You'd have to ask my daughters that, Hallie. I don't know.
Thank you, guys.
Great. Thank you, everybody.
Thank you.
Yeah.
As an angle here, and even though you kind of like mark my file here.
Thank you, everyone. Thank you. Thank you, Mommy. Oh, thank you. Yeah.
At this point, what do you say about the lighting being so airtight?
I guess I was talking about a challenge to the measure qualifying or a challenge to the actual substance of the proposed initiative?
Yeah, the substance itself. You're saying these guys over here.
Yeah, well, I'm here wearing Planned Parenthood Arizona hat, so I don't want to talk too much about the initiative. But what I will say is that it's a constitutional amendment. It will be hard for the court to do too much with it. And actually, if you want to ask or find out what the other side of this issue thinks that the result of the constitutional amendment will be, you should talk to them. They've been very publicly putting out statements about if this measure were to pass, X restriction would fall by the way, Y restriction would fall by the way. So I don't want to comment on hypotheticals, but I refer you, at least as I sit here now, outside of this courthouse today, to ask the other side
But yeah.
Good, I'm glad. That's a good sign.